Welcome back, everyone. Today, we are kicking off a brand new chapter in our human nutrition course with this explainer. And we're starting by zooming way out to look at the multifaceted global nutrition crisis. This isn't just textbook theory. This is a massive issue that impacts literally billions of lives. So as students of nutrition, and honestly, just as global citizens, we really need to understand the true scale of this crisis, who's actually most affected, and the deep systemic roots that keep it going.
Okay, let's dive into this. 828 million. As of 2021, up to 828 million people across the globe were classified as undernourished. I mean, that is just an absolutely staggering number, right? And the crazy part is, it really just represents the massive tip of the iceberg we're analyzing today. When we talk about global nutrition, we aren't just talking about individual, day-to-day dietary choices. We're talking about a systemic, worldwide crisis on a scale that's honestly kind of hard to wrap our heads around. To help us make sense of all this, here is our roadmap. First, we'll define the global crisis. Second, we'll look at the populations at highest risk. Third, we'll dig into the roots of undernutrition. Fourth, we'll map out the global impact and mortality. And finally, we'll wrap up with the consequences and how we can actually intervene. All right, let's jump straight into Section 1, defining the global crisis. To truly grasp this, we first need to break down what malnutrition actually means. You see, malnutrition at its core is basically a massive imbalance. Think of it as a crisis of extremes. On one side of the spectrum, we have overnutrition. This is excessive intake leading to being overweight or obese, and right now it affects over 1.9 billion adults globally. On the exact opposite side, we have undernutrition. This happens when a person suffers from a chronic lack of energy and nutrients over an extended period. And to be clear, this isn't just about feeling hungry before lunch. It's a persistent deficiency driven by poor nutrient density in the diet, ongoing disease, or even complex medication interactions. Now, while both are huge global issues, our main focus today is going to be on the devastating impacts of undernutrition. Just to put this into perspective, right now, roughly 10% of the entire world's population faces this persistent threat of undernourishment. That is 1 in 10 people waking up every single day without the basic physiological fuel their bodies need just to function normally. And unfortunately, as you probably know, this whole situation was recently and severely exacerbated by the COVID-19 pandemic, which completely shattered global supply chains and local economies. Moving right along to Section 2, populations at highest risk, because undernutrition doesn't impact everyone equally. Vulnerability really spikes during specific stages of the human life cycle, specifically stages of rapid physiological growth, or, on the flip side, physiological decline. First up, pregnant women are at extreme risk. Maternal undernutrition doesn't just lower the chances of conception, it significantly increases the risk of delivering low birth weight infants who unfortunately have much lower survival rates. Then, of course, we have infants and children. Those first 2 years of life, that's the absolute most critical window for getting nutrition right. Finally, skipping to the other end of the timeline, we have older adults. Aging naturally brings physiological changes, things like impaired nutrient absorption, decreased muscle mass, and even just losing your sense of taste. All these factors independently and combined seriously heighten the risk of chronic undernutrition as we get older. And this brilliantly illustrates one of the absolute most tragic outcomes of missing that critical infant window: stunting. So stunting is defined as a reduced adult physical size accompanied by cognitive delays and a depressed immune system, resulting directly from undernutrition in those first 2 years of life. But here's the really scary part. The devastating consequences of stunting do not stop in childhood. For instance, stunting in female infants later creates severe maternal health risks when they become pregnant adults. We're talking about life-threatening complications that might require a C-section. And in underdeveloped areas with limited medical access, a C-section can easily be fatal. It's just a tragic compounding effect. So why does this happen? Let's look below the surface in Section 3, the roots of undernutrition. We can basically categorize the systemic drivers of this crisis into 4 main buckets. First, socioeconomically, we're looking at things like poverty, overpopulation, and the massive disruptions caused by war and political unrest. Environmentally, populations suffer from depleted farmland, a total lack of natural resources, and, maybe most critically, lacking sanitary water supplies. Next up is infrastructure. Look, even if the food exists, if there are distribution problems or just a lack of adequate roads, that food is simply not reaching the people who need it most. And finally, biological factors. Widespread disease and parasitic infections actively rob the body of the nutrients it actually does manage to take in. So the crucial point is this. while all of those factors play a massive role, poverty is the leading overriding risk factor globally for undernutrition. It's the primary engine driving the entire crisis. Think about it. Poverty dictates where you live. It dictates the quality of your local environment, whether you have access to infrastructure and your vulnerability to disease. It is literally the common thread tying this whole complex crisis together.
Now, let's look at how this plays out geographically in Section 4, Global Impact and Mortality. The deep inequality of global health becomes incredibly glaring when we look at the prevalence stats from 2021. In sub-Saharan Africa, a staggering 23.2% of the population, that's over 260 million people, face undernutrition. If we look at the entire continent of Africa, it's 20.2%. Southern Asia, they're at 16.9%, which affects over 330 million individuals. The Caribbean sits right around 16.4%. Now contrast those staggering double-digit percentages with Northern America and Europe, where the prevalence drops all the way down to less than 2.5%. The geographic disparity in basic human nutrition is just profound. Now, what's really interesting about this slide is how it translates those regional percentages into actual human lives. Experts heavily rely on the under 5 mortality rate, which is measured per 1,000 live births, as a key indicator of a nation's overall nutritional and medical health. Looking at 2020 data, in Nigeria, 114 out of every 1,000 children do not survive past their 5th birthday, largely driven by nutritional deficits and the diseases that come with them. In India, that number is 33. In Iceland, it is exactly 2. This stark contrast really emphasizes the heavy, real-world human toll of the systemic issues we've been talking about. This brings us to our final section, Section 5, Consequences and Interventions. The thing you really need to understand is that chronic undernutrition doesn't just harm an individual in the present moment, it creates this vicious, self-perpetuating generational cycle. Step 1, it starts with reduced cognitive ability in childhood. Because of that cognitive delay and physical stunting, it leads directly to Step 2, decreased economic and physical productivity in adulthood. And what happens then? That lack of productivity traps individuals in the exact same poverty that caused their undernutrition in the first place, which leads directly to Step 3, compromised reproduction. The next generation is born highly vulnerable, and the whole devastating cycle simply starts all over again. But there is hope. To break this cycle, targeted intervention strategies are absolutely vital. We can't just indiscriminately throw food at the problem and expect it to go away. We have to be strategic. Key global efforts include proactively improving breastfeeding rates to protect that critical infant window we talked about. We absolutely must increase access to safe, sanitary water to prevent parasitic infections from stealing nutrients. On the treatment side, utilizing specialized therapeutic foods can rapidly rehabilitate severely malnourished children. And hey, we can't forget our older populations either. Enhancing nutrition education for older adults helps them navigate the natural physiological changes of aging so they can maintain a healthy, balanced diet. So we've covered the global, macro level of malnutrition today, but this naturally leads us to our next big question. In our next explainer for this chapter, we are going to zoom way in to the biological level to explore the sometimes alarming world of common micronutrient deficiencies. Because to truly master human nutrition, we have to ask ourselves, when a diet fails, what exactly happens inside the cellular machinery of the body when specific essential nutrients are simply missing? We'll see you in the next one to find out.